Clinical Pharmacology for 7th semester medical students. Clinical pharmacology is a branch of medicine that studies the use of drugs in humans, covering mechanisms of action, side effects, drug interactions, pharmacokinetics, pharmacodynamics, and their application in disease management. In the 7th semester, the primary focus of clinical pharmacology is integrating basic pharmacology theories into clinical practice for effective and safe patient management. 1. Fundamental concepts of clinical pharmacology, a pharmacokinetics. 1. Absorption. The process of drug absorption from the site of administration, oral, intravenous, subcutaneous, etc., into systemic circulation. Factors affecting absorption: gastric pH, food intake, drug formulation. 2. Distribution. Movement of drugs from the bloodstream to body tissues. Influenced by plasma protein binding, e.g., albumin, lipophilicity or hydrophilicity of the drug. 3. Metabolism. Biotransformation of drugs, primarily in the liver. Phase 1. Oxidation, reduction, or hydrolysis reactions, cytochrome P450 enzymes. Phase 2. Conjugation to enhance water solubility, glucuronidation, sulfation. 4. Excretion, elimination of drugs from the body through kidneys, liver, or lungs. Crucial for determining drug half-life and dosing frequency. B. Pharmacodynamics. 1. Mechanism of action, drug interactions with receptors, enzymes, or ion channels. Agonists activate receptors. Antagonists block receptors. 2. Drug effects, therapeutic effects, desired effects. Side effects, undesired effects, ranging from mild to severe. 3. Therapeutic index, ratio of toxic dose to effective dose. A smaller therapeutic index indicates a higher risk of toxicity. 2. Drug categories by body system. In the 7th semester, students study various drug categories based on diseases or specific body systems. A. Cardiovascular system drugs. 1. Antihypertensives. Examples: ACE inhibitors, enalapril, ARBs, losartan. Beta blockers, metoprolol. Mechanism: lower blood pressure via different pathways, reducing peripheral resistance, decreasing blood volume. 2. Antiarrhythmics. Examples: amiodarone, lidocaine. Mechanism: restore abnormal heart rhythms. 3. Anticoagulants. Examples: warfarin, heparin, DOACs, rivaroxaban. Mechanism: prevent thrombosis by inhibiting coagulation factors. B. Respiratory system drugs. 1. Bronchodilators. Examples: salbutamol, short-acting, salmeterol, long-acting. Mechanism: Relax airway smooth muscles via beta-2 adrenergic stimulation. 2. Inhaled steroids. Examples: budesonide, fluticasone. Mechanism: reduce airway inflammation in asthma or COPD. 3. Antihistamines. Examples: loratadine, cetirizine. Mechanism: block H1 histamine receptors, alleviating allergy symptoms. C. Gastrointestinal system drugs. 1. Antacids. Examples: aluminum hydroxide, magnesium hydroxide. Mechanism: neutralize stomach acid. 2. Proton pump inhibitors, PPIs. Examples: omeprazole, pantoprazole. Mechanism: inhibit proton pumps in gastric parietal cells, reducing acid production. 3. Antiemetics. Examples: ondansetron. Metoclopramide. Mechanism: block serotonin or dopamine receptors. D. Nervous system drugs. 1. Analgesics. Examples: paracetamol, NSAIDs, ibuprofen, opioids, morphine. Mechanism: reduce pain via various pathways, COX inhibition, opioid receptor binding. 2. Antiepileptics. Examples: phenytoin, valproate, lamotrigine. Mechanism: stabilize neuronal membranes. Reduce excitatory activity. 3. Antidepressants. Examples: SSRIs, fluoxetine, SNRIs, venlafaxine. Mechanism: enhance neurotransmitters like serotonin and norepinephrine. 3. Drug interactions. A. Pharmacokinetic interactions. 1. Absorption. Antacids reduce antibiotic absorption, e.g., tetracycline. 2. Metabolism. Enzyme induction, e.g., rifampin increases warfarin metabolism. B. Pharmacodynamic interactions. 1. Synergism. Two drugs enhance each other's effects, e.g., antibiotic combinations. 2. Antagonism. One drug reduces another's effects, e.g., NSAIDs reduce antihypertensive efficacy. 4. Side effects and toxicity. Mild side effects: dizziness, nausea, mild skin rash. Severe side effects: anaphylaxis, liver failure, severe arrhythmias. Toxicity. 1. Paracetamol toxicity, liver damage. 2. Digoxin toxicity, cardiac rhythm disturbances. 5. Therapy based on clinical cases, a hypertension management, first-line drugs. ACE inhibitors or ARBs. Combine with diuretics if blood pressure remains uncontrolled. B. Diabetes mellitus treatment, first-line drug, metformin. Add sulfonylureas or insulin if necessary. C. Infection management, antibiotics based on bacterial sensitivity, e.g., amoxicillin for upper respiratory infections. 6. Clinical pharmacology practice, a case studies. Writing prescriptions for specific diseases. Calculating drug doses based on body weight or patient conditions. B. Drug monitoring. Measuring blood drug levels for drugs with narrow therapeutic indices, e.g., digoxin, warfarin. C. Patient education, proper drug usage. Recognizing potential side effects. 7. Ethics and regulations. A. Rational drug use. Prescribing the right drug for the appropriate indication at the correct dose. B. Preventing drug misuse. Monitoring drugs prone to abuse, e.g., opioids, benzodiazepines. Clinical pharmacology is a vital pillar in medicine, bridging theory and practice to ensure safe and effective patient treatment.